Hello, everybody. This is Black Coffee with Ice. We have a dog lover, graston specialist, chiropractor, Instagram at Chiro by Day. Listen in to find out what she does at night. Ladies and gentlemen, we have our first doctor on the show, Dr. Manny. Yay.
Yay.
What an intro.
Yeah, what a great intro.
So, explain who you are just briefly.
Okay. Well, my name is Dr. Manny, and my last name is Sani. They kind of rhyme. And I work in East Kildonan right now, and I've been there for almost 2 years, and I'm an associate chiropractor there with 4 other doctors as well. And what else?
What
else
else?
would you like to know?
Oh, yeah. We were talking so easy before it started.
What else would you like to know?
What motivated you to become a chiropractor?
Well, this is a really good story. It's actually pretty interesting. So I started off doing everything to go into optometry. So my plan was to do optometry school. And at the same time, my mom was pretty sick. So I started, it was a little stressful with stuff going on at home with her. And it seemed like every year while I was in undergrad at U of M, she was getting a surgery for something else. And it just seemed a little intense to me that it was like, okay, if this isn't working for you, let's jump to surgery. And I'm like, there has to be something in between, and it was really frustrating because I don't know, I guess I had honestly didn't know what else was out there for her. And so, you know how schools have career fair days? And so just like any other student, I wanted free stuff too, like free pens and all of that. So I was there, and the school I ended up going to was there. And one of the girls there was talking to me, and it just seems like, when you have those things in your head where you're thinking and then the universe brings it to you.
It's true. It happens.
Yeah. And so that's how I always say this about this girl. Her name was Chantel. So I always say that about her because when I was going through thinking all about these things that my mom could have had done, I'm like, I don't understand. There was nothing there. So she came up to me and started telling me about chiropractic. And at first I was like, I don't really know anything about it. I was a little skeptical too. And so when she was talking about it, she's like, we can help with low back pain. We can help with lots of things. Everything's natural. It's a lot your body can heal itself. There's different alternatives as well. There's acupuncture as well at the school. There's massage therapy. So I was like, okay, this is interesting. So I got in touch with the career mentor services that I think that are at U of M still. And then I got in touch with them to shadow a few chiropractors. And so when I shadowed them, first I was like, they're whatever.
Yeah.
Not a big thing. But this one doc, he's on Pembina, and he actually was only supposed to see me for an hour. He's let me stay there for 4 hours. And we talked for so long, and I had a list of questions, and he's like, I really want you to shadow more doctors. I don't want you to just feel like I'm the only one. This is how chiropractic is. You need to talk to a lot of them. So I went back again, found another doctor, same thing again. The more I started doing it, the more I started liking it. And so then I thought, okay, you know what? I'll apply to the school. So before I applied to the school, I contacted them. And I said, I'm really interested. And they were like, okay, what experience do you have with, with chiropractors? I'm like, not much. I've just shadowed 3 or 4 at the time. And they're like, you should really go back and shadow a few more because this is a huge investment.
Oh, they said that too.
Yeah. And they're like, this is a huge investment. And plus I went to a US school as well. So you're paying in American dollars, right? Damn. So they were like, we recommend this to all Canadians, especially if they're not that familiar with the field, to definitely see more. So I saw about another 3, and I was like, you know what? This is it.
That was it?
Yeah, that was it. I didn't even apply to do the optometry admission test. I went straight to, yeah. So I went straight into applying for there. And the thing was that because I was almost done my science degree, I already did the requirements for chiropractic a year earlier. And so I was already ready to go. I applied. I had a few references, and within 3 months, I got accepted. And so I wanted to start in January of 2013 because I wanted to be able to make money because I knew I wouldn't be able to work in the U.S.
Oh, yeah.
So, and, I was working a lot, and then the school reached out, and they're like, hey, a spot opened up for the fall. do you want to come in the fall? And I was like, no, I don't have the money right now. And they're like, okay, all right, that's fine. And then they said, just so you know, there are actually scholarships available. And so there was a scholarship. I got a few throughout my whole time there. There was lots of different ones that were available. Like, I mean, any scholarship you get, even if it's $100, it helps. It's not a big deal, right? So
just chips away.
Yeah, it helps, and especially if it's $100 US, that's almost like a lot in Canadian.
Yeah.
And so I got into the school, and I loved it. I actually really loved it. It was a little more stressful because I had to move. And on top of that, you don't get a summer break if you go to school in the States.
Yeah, just sorry to interject here, but just what you told me before we started the podcast, I didn't even know about it, that you can do an accelerated program like you did. So can you just explain that?
Yeah. So how it worked, at my school, I went to Minneapolis. So at the school there, it goes by trimesters. And so you would have, like, midterm week was like 3 midterms a day for like 4 days straight. Some of them were labs. No one cared. You all went through it together. And then the finals, same thing. But the thing was, you would get a week or 2 weeks off. Christmas time, I think, was the longest. We got 3 weeks off. And then summers were 2 weeks. And you just kept going.
2 weeks?
Surprisingly, 2 weeks was actually enough, because I think just driving home to Winnipeg, and then that's like an 8-hour drive, because you got to put in the construction in there too, the construction time. And so, I mean, I feel like just driving was probably enough to de-stress me. Just
listen to some music, chill out, see your family.
Right. And then you go home and you're rested and you're ready to go again. So it actually didn't feel as bad. And I'm so glad I did it that way, because it was just done quicker. A lot quicker. And I feel like there are some other programs in different professions. I know nursing has one that's similar in Alberta.
Yeah, you can get it done in like 2 years, I think.
Something like that. Again, they also don't get a summer, but at least you're done a lot faster.
It's all about give and take, right? Like, you want to be busier in a shorter amount of time, or do you want to stretch it out? Because I know some chiropractic schools some are even 5 years long, aren't they? Yeah.
I think the Canadian ones are, I believe.
Okay.
I'm not sure exactly. It might be the one in Toronto, because they do get a summer break there.
Here at Black Coffee with Ice, one of the niches that we're focusing on is healthcare, different health modalities, longevity, living a healthy life. I don't know if you follow chiropractors online at all.
There's a few. Yeah.
Do you know that Dr. Joseph Cipriano? He's kind of like he's like a thicker guy. He's
he has a YouTube channel too.
Yeah. I'm gonna do the Y strap. That guy. Yeah. I messaged him before he was big time. Like, now he has hundreds of thousands of followers, but I talked to him when he had like a couple thousand, because I am obsessed with chiropractic videos on YouTube. And the main reason I asked him, I was like, because I have an internal debate in my head, like chiro or medicine. Like, I've always had to battle with this my whole life, and I just didn't know which one I'd want to do. And when I asked him what made him choose chiropractic over other health care modalities, he told me that chiropractic is more preventative rather than reactionary. So if you're a surgeon, you're going to be fixing a guy or a girl who, has arthrosclerosis, and that's like a whole lifetime buildup of like an unhealthy lifestyle. I mean, genetics play a role, but he was telling me chiropractic's more preventative. I know you said that you liked chiro, but is there any other specific reasons why you went with that instead of optometry?
The more I learned about it, I realized that it was probably, like, I still wonder to this day, had my mom started with chiropractic, like, how different would her life be right now?
Because she's an optometrist?
No. My mom, because she had so many surgeries and all that.
Okay, I'm sorry.
So, no. So I always wonder, because her range of motion it's a little limited at this point, and she just retired. So I always wonder, like, what would it have been like had, she had started. And so with optometry, I found, it's very interesting, but I didn't know if I would like to look into people's eyes all the time. That's just me. So with the spine, when people come in with chiropractic, it's so many different things. It's either low back, neck pain, shoulder, TMJ, like so many things. So it's not like I'm just sticking to one thing, which I like better. I feel like it just makes my brain work a lot better when everyone's coming with something different, because I don't want to I feel like if it's something similar, this is like with any routine I may have. If it's similar for too long, I get bored.
No, that's definitely me too.
Yeah. So I need to be like stimulated and doing different things. And then on top of it, there's something I don't know too much about. I love researching it. I love learning. And so I feel like that was one of the more things that I enjoyed more about it. And also with just that it's very natural. Like there's the body can do a lot by itself that we don't even realize it can do.
Your body repairs itself when it sleeps. You know, your body fights off all these infections, pathogens. Your body can heal itself. I just wanted to ask you, what do you say to people that there's always this generalized stigma? Not really a stigma, but you know what I mean. Some people just look negatively on chiropractic. We talked about this earlier.
Right.
I personally think it's because the market is oversaturated and some bad chiropractors might give the profession as a whole a bad name. But what do you say to people who are on the fence, and how do you bring them in?
Well, that's a good question. It's funny you say that, because a lot of there's like a certain demographic. So it's usually dads who work really hard and don't want to go see any doctor. So it's usually when they come into our office, it's usually because a wife made them come. And so when they're there, they're like, oh, nothing's wrong with me. Nothing's wrong with me. I'm like, okay, that's fine. You know, the first time I meet somebody, it's usually an hour long. We go through an intake, and then we also do an exam. And so what I find during that time is when we get more deeper into their health history, they start realizing things that they have never said out loud. And I'm like, well, how long have you had this? And they're like, I don't know, like 30 years. And I'm like, you never thought about getting it looked at? And he's like, well, no, I'm so used to not having to put my arms above my head. I'm like, you're too young. Like, you should be able to do that. And so for like, I guess it's just, it takes them a minute to realize that. And then, so then we start with the exam. So I look at their range of motion and I'm like, you should be able to do this much, and you can't. And so, and I always leave it up to them. Like, it's up to you. If you would like me to adjust you, this is what chiropractic is. There's different forms of adjusting. Some people don't like hearing any cracking sounds. That's what an activator is really good for. Yeah. So there are some people who hate having their neck turned around or anything. Totally understandable. Yeah. But there are different ways of adjusting. So I think if you present people with options, they can, because what do we all do? We Google everything, right? Yeah. So if I say something, oh yeah, I use the activator, I've had people call back into the office, say, what is that tool that they use that sounds like a stapler? Because they're Googling to find articles.
Is that gun?
Yeah.
Oh, okay.
And so I always let them know it's an activator. Just go on their website. There's lots of articles there. And, there's a lot of research to show what it does. And so I find just giving options, I feel like it's a lot better. They can make their own decisions. At the end of the day, they got to do what's best for them. And so also I feel I've had this comment a few times too, where it's like, when I came in, I thought you were going to be a middle-aged man. And I'm like, no. I'm like, I'm sorry, I'm not. They're like, oh, okay. They're like, it's just, usually like they're kind of grumpy. I'm like, well, I don't know. Maybe that's one or two you've gone to, but not everyone is very grumpy. So it does. I feel like the more information you give, it depends how they want to take it. So I never like to force people into anything. I do tell them the benefits of chiropractic. And of course, our consent form also talks about, some of the risks that you hear of. Sometimes, it doesn't happen very often, but sometimes you might hear a rib pop, right? And so ribs heal naturally by themselves. You can't really do too much about that. Same with some of your toes. You can't really fix that either. You got to wait for it to heal by itself unless it's really, really badly displaced. So, when we go over it, we outline everything, and they have questions or they can ask me. It's all great. But
that's good. That's the way it should be. Yeah. I just want to mention, like, that's where healthcare is moving, all about like patient-centered care, working with the patient to come up with a plan that is the best for them.
Right.
So giving all those options. So what is your opinion on this?
Okay.
No, you don't like self-adjusters?
No, I don't. And I think
Sorry, I had to do
no,
that.
it's all
You're
good.
Like, ugh, cringe.
I feel like it's always the younger generation who does it. But there's also, I've had this happen, and I'm sure other chiropractors will agree with this, where younger kids are watching YouTube videos constantly. Just like we were discussing, we watch YouTube a lot. So I've had this happen where these two young kids wanted to adjust themselves. So they adjusted their neck. And he's had so much pain since he came in. And I just looked at him. I was like, what do you mean? He's like, well, we were just watching this video. And I mean, it does say on the disclaimer, please do not try this at home. And so they're 15, 16-year-olds. And they did this, right? And I'm like, where are your parents? Like,
That's
I don't
so
understand.
bad. The neck. Why did they do the neck?
They saw it on video, so they thought they could do it. Just like, I can't remember, was it they were pouring hot water on each other? There was a YouTube video about that. It was some sort of challenge, and I'm like, why? You know, but sometimes you don't know what you're doing. And some people, like with their neck, he didn't know what he was doing. And I asked him, like, how did you know where to touch? And he was like, well, we just followed where his hands were. I'm like, every spine is different. He's not just touching anywhere. He's actually touching a certain part of a bone. And I don't know if maybe that should be like a bigger disclaimer on videos for
because don't self-adjust.
And I don't think those chiropractors are actually marketing to 16-year-olds to be, doing this, but people do it all the time. And so even with like, sometimes I'll have people come in, they're like, oh, I just adjust myself at home. I'm like, okay, well, what are you adjusting? I'm like, well, I don't know, I just hear stuff. And I'm like, if I could adjust myself at home, it would be great. But I always have to get adjusted by somebody here at the office, because even I don't know how to adjust myself. And they're like, oh, okay.
Yeah, that's just, oh man, I'm cringing here. I'm just like, God.
Yeah.
That's scary. Just kids will do whatever these days.
They do. So the good thing is that because they're minors, their parents are usually there. The parents had no idea that that's what they were doing. Yeah. So the parents actually had no idea that their kids were watching these YouTube videos, and they're like, oh my goodness, we need to set up parental stuff on here. Like, I had like one mom apologize to me about her son. I'm like, don't apologize to me. That's your son. Like,
you ever watch those like ASMR Indian barbers? Like,
no,
India?
but I hear about it all the time.
Yeah, it's like the best ASMR ever, but they're just like crack. Like, they just grab the neck and like pull it. I'm just like, oh my God.
I've heard about that, but I haven't really made myself watch it.
I'll send some links, but you'll cringe. You'll definitely cringe. Like, there's like head pulling. Well, it sounds good, but it just doesn't look like it would feel the best.
And that's the thing. Like, it may sound or feel good, but do you really know what you're doing?
Exactly, right?
So,
and honestly, it's like an addiction for me to crack my neck. I want to stop, but it's just like, I know I should stop, because I know one day I'm just going to mess up one of these arteries and it's game over.
At least you know.
Yeah, at least I know, right? Oh my
God. I know it does it'll take you some time to slowly fight the urge to not do it.
Yeah. Okay, I'll stop for you. I promise. So I just actually wanted to ask you too. There's things like Gonstead. There's like the diversified technique. There's all these different types of techniques. Which one do you think is the best, or do you think it's the best to mix different types of chiropractic care?
That's a really good question. So the one that I use more is diversified and activator. So I can't really say which one's the best, because I don't know about how everyone is exactly, right?
Good answer.
Yeah. Well, I like to
be a politician.
No. Well, what I feel is that what should be the end goal is if you're improving. So, for some people, maybe Gonstead is the way to go. That's what they like. They've gotten great results. Great. Stick with that. Stick with someone who does it. If diversified is what you like, stick with that. And that's what you've gotten the results. If activator is one, I always say that to people, whoever it is, just stick with wherever you're getting really good results, because everyone's different. Everyone has a different preference. So that's the thing. Like, there are so many different techniques out there, and I can't really say if one's worse than the other, because I don't know all of them.
Yeah.
So it's not fair for me to even make that kind of assumption.
That is true. Do you ever like Y-strap adjust or Y-axis distraction or ring dinger? No.
No, never done those.
No. Okay.
I've never done it. I know you were just mentioning that too. I was like, I've never done it before.
Okay, well, maybe one day.
Because I feel like, isn't that just cervical traction?
Yeah, it is. Yeah, I think so. So it's just, apparently you feel it all the way down.
Oh, really?
Yeah.
Okay.
So I don't know if you've seen it before, but you're basically laying down, your legs are elevated. You like locks your hips into place and then puts a towel around your neck and then just like pulls on the y-axis, I guess.
Okay.
Explain to me and the lay person listening.
Mm-hmm.
I'm also a lay person. What graston is and what fascia is, like how it improves blood flow. Just educate
Graston?
me on
Okay.
graston.
Okay. So graston is actually, you use stainless steel tools to actually break down any of the fascia. So you know how sometimes you might get those when you're feeling a muscle, if it doesn't feel smooth and you feel those little crunchies. I call them crunchies because when you press on them, they feel a little crunchy. Or you might feel like it's just too tight. Sometimes it'll get so tight that it feels like you've got like rocks in here. So what graston does is that you're actually kind of scraping down. It's not very sharp tools, and every time I pull them out, people think it's gonna, like, they're gonna bleed. They're not gonna bleed. So what you're doing is just kind of going through the fascia, trying to just smooth it all out, and in the process, you're bringing more blood flow into the area, so that way it heals whatever is going on in there. And so it does leave bruising, but it feels so much better. It's so great for ligaments. It's so great for muscles. I've had it done on myself so many times, and I do it a lot on people, especially for their traps. Like, traps are so tight, extremely tight, or even just right in here in your forearms. Oh, yeah. Especially if certain professions like plumbers and painters, anyone, or even car mechanics, all of them will have such tight forearms. And so when I do graston on there, they're like, oh my God, it feels really good. It hurts for like 1 or 2 days. But what you're trying to do is trying to make that muscle nice and smooth, so that way you're actually getting better range of motion compared to if it was still locked in that position.
Yeah, and that's a huge part too. If you have very tight forearms, you might have an elbow pain or something along those lines, and it just goes to show how connected our whole body is. Is it almost similar to like rolling? And
it is, but it's a lot more pressure, and you're very specific on the strokes. So different strokes mean different things as well. So that's why certain tools are used, and like there's a set of 6 of them. And so you kind of know exactly which one to use for which body part. And I mean, all the muscle fibers run differently. Some of them run like this way. Some of them run up. Like, you got to know the anatomy before you do it.
Okay. Cool. Yeah, because I do this thing called mobility WOD. It's this physiotherapist guy, and he just has all these different ways to break up the fascia. When you break up the fascia, the tissue moves better, and you feel better. But I really am gonna try the graston with you. I can't wait. Yeah. I was looking like last year. I was looking for everybody. I guess before you. Well, no, I guess you've been practicing for a year.
Yeah. Well, 1.5 years almost, yeah.
Almost 2.
Yeah, almost 2, yeah.
Getting up there.
Yeah, and so same thing with graston. So when people have questions about it, I did post it on my blog because a lot of people didn't know anything about it. But I also would recommend, if you're really curious, Google it. Just like you Google everything else. Just Google that. And the graston website has some really great articles, videos, everything that's there to show you how it helps. Athletes love it. I know a lot of athletes love it. Same with dancers, like professional dancers. And yeah, I love it. I'm not an athlete, but
that's okay.
Yeah.
You're kind of your own type of athlete.
Yeah, I guess so.
Cracking bones and
yeah. Well, like I don't crack them. I adjust them.
Oh, sorry.
So,
sorry.
So with like for chiropractors, a lot of us get very tight forearms. So I will do it on here at least every 2 weeks. Just to make sure my arms are nice and loose too.
Okay, yeah, because I box, and I'm definitely going to see you for my knee because I've been having trouble with like my hamstring tendons apparently, but yeah, definitely would like for you to look at that eventually.
Do you stretch?
I stretch a lot. Like, I'm very particular on preventative stuff, so I always do rotator cuffs. I always warm up, stretch as much as I can. I think I was just overexerting it, and it just now it flares up if I push it a little too hard, which is really annoying because if I'm on a jog and then out of nowhere it just starts getting sore, I have to walk. It's so annoying. But.
And there's also like other things too for athletes, like certain things that you're putting in your body, you want to make sure you're actually replenishing your muscles too, right? So I know sometimes people will drink a lot of protein shakes. A lot of them, I don't know what's exactly in a lot of them, but there's different types from my understanding. And I always tell people, like, read the bottle because it'll tell you when you should be taking a break from it. And they're like, you don't need to take a break. I'm like, no, it says on the bottle you need to take a break at a certain time.
It's true. People don't even understand all the shit they're putting in their body. Like,
right.
When I see people drink Monsters or chugging pre-workout. Right. Crazy story. I was taking pre-workout and I had a heart palpitation at the gym. And then I literally had to take 6 months off because I had to wait for an MRI because some doctors thought that I had a genetic heart condition. And if I had that condition, I couldn't work out or play sports anymore. So I was literally just waiting for months, getting out of shape and being depressed and anxious, just waiting. And it's all because of pre-workout. So people need to realize that.
Whatever you put in your body is how you're going to feel.
Exactly. So yeah, any other health tips for people listening?
Yeah. You know what? I think definitely stretching. I feel so many people do not stretch. So when I give, my patients like to call it is their homework. So when I give them stretches to do, they only do it. This bothers me so much, and they know it bothers me. They will only do it until they start to feel better.
Oh.
And I always say to them, okay, that's great, but why did you stop? They're like, I was feeling better. I'm like, really? Because I don't remember putting a deadline on the stretches that I gave you. And they're just like, oh my God, I knew you were going to say that. And so, I mean, even if you think it's not a huge workout, like shoveling is a workout. You really do need to stretch. You really need to watch your body mechanics when you're doing it. Lifting with your knees. Don't just lift at the waist. And also making sure you're drinking lots of water. Water is something people barely drink anymore. And eating right. Make sure you're sleeping well. And mental health is another big thing that I think if you are so stressed out, you're not going to feel better because you're going to be so tight all the time. And when you're super tight, you're also going to be breathing from your chest as opposed to your diaphragm. And so, just like you were mentioning, like anxiety, all of that. So I always, if someone comes in and they are super, super anxious, I always ask them, do you talk to a counselor? Do you talk to anybody? Patients who've gone through really like just grief, right? And so even grief plays a huge role. And so I honestly think the body, mind, spirit are all connected. So if one of them's out of whack, it's going to show up in the other two spots too. And so when I will address that. Like I think a lot of healthcare professionals are addressing it now. Because if there are resources out there for mental health, and if you're not in that headspace, your thoughts aren't going to help with how you're feeling. So if you're constantly saying, oh my God, I feel like crap, this is not going to work, it's not going to work. Well, the universe is not going to, you know how it is, right? You attract what you don't want.
And you got to speak it into existence. And,
right.
And placebo, even, like, I'm not saying, like, chiropractic's a placebo. I believe in chiropractic wholeheartedly. But the thing is, just people believing that something's going to work is going to benefit them. The mind and the body and the soul, all connected.
Right.
Just like all your tissues. Just like how your elbow is going to be sore if your forearm's tight.
Right.
Everything's connected. So.
Right. So if your neck is so sore, chances are you're going to start getting headaches. When you get headaches, you're not going to be sleeping well depending on how often they're coming. You're not sleeping well, then you're crabby. When you're crabby, what happens? You're always so mad, right? When you're mad, you're so tense. So it's just a continuous cycle. And I mean, even food too. Watch what you're eating. Try to get some really good veggies in. I know a lot of patients will joke around, especially the dads that I was talking about earlier. They will joke and say, well, I had one leaf of spinach. Is that enough? I'm like, no, it's not. And like we were going back to that part where, some of them are a little nervous or just skeptical, right? I feel like those are my favorite ones because once they start working with a chiropractor, not just me, but just with anyone, they start to feel so much better that they're like, why did I not believe this before? I'm like, I don't know. But you always do have to find the right person for you in any health profession that you're looking at. Not everyone jives with everyone. So those dads that I was talking about earlier, when they came in, I think about 2 weeks later, they're like, hey, watch this. I'm like, what? And I mean, we've had a few treatments in between then, right? So they're like, okay, watch this. So they show me the things that they couldn't do before. And they're so proud of themselves. Like, they're just like, I can touch my toes now. I'm so excited. I haven't done this in so long. I was showing it to everyone. And I'm like, oh, that's nice. It's actually super nice to hear. I'm like, but you could have also done that 30 years ago.
I know. If you just addressed the problem when it first came.
When it first came. And I'm like, so it wouldn't be such a shock right now. And they're like, I guess.
Whatever.
Yeah. You know what? Yeah, you're right. I'm like, okay. And then they end up just, they tell everybody and they get so excited about it. And I'm like, that's what we need. It's just people more excited about feeling better and wanting to stay better.
People are starting to realize, wow, like I can I can live a lot longer and healthier and more functional for a longer period of time, not just 35 or 40. My back's sore and just that's it.
Right.
Like you can change it.
Well, like I am obsessed with chicken nuggets, but I eat them in moderation because I know they're not great for me. And so I know there's people who love pizza. They eat it for breakfast, lunch, dinner all the time. And when I'm like, well, I also really love chicken nuggets, but, it's once a week type of thing for me. And it's not all day. And they're like, well, isn't it hard? I'm like, well, yeah,
it's
but
not easy.
I'm not denying myself of it. I'm still eating healthy. So my reward are chicken nuggets.
And that's good. It keeps you focused throughout the week. And you're like, hey, I can't wait for those chicken nuggets on the weekend.
Right.
Yeah. Oh. So I guess just let everybody know about your future endeavors with respect to social media.
Well, with social media, okay, so my plan is, so I got a blog, and I made this blog about almost a year ago. We were just saying that. I'd like to, I have a few collabs that I do on there with, a nutritionist. I've had an athletic therapist on there as well. And so I find it's very helpful for people because a lot of my patients do read it. And so sometimes I will get people, right now I'm doing a pregnancy series with one of my good friends. Her name's Danielle. And so I was so shocked to see the response from that. She talks about the nutrition side of pregnancy and I talk about, low back pain, different parts of the pregnancy. So it was very interesting to see there's information that people want to know, but they haven't told anyone. So I always ask for questions on my stories. So every once in a while, I'll always put on stories what would you like to learn more about? And so I've always gotten really great responses, things I would never have thought of. And so I feel like that's super interesting for me because I'm like, I would have never, okay. I didn't really think that was something. If I can't address it, I'll find someone who can and I'll put it on there. But yeah, and I want to like we were talking about making videos. But yeah, and I have a few workshops that I'm doing, a few talks later in the future, not anytime soon, but yeah. But yeah, I just want to promote chiropractic and just make it just something that people aren't so scared of. And
yeah, I think, and what I was just saying earlier, just about the oversaturation, some people may ruin the name for everyone, but what I'm getting from meeting you care about your patients. You take the time to really figure out what's wrong. Like you were saying, it takes an hour of your first appointment
visit. Yeah. A lot of offices are like that. So that's why I'm surprised when someone comes in and they've never had that experience and they're like, why is it an hour long? And I'm like, because we're going to talk about you. That's the point.
Yeah, I'm not just trying to make money. I'm trying to help you live better. So.
And especially, sometimes you need to refer them out. If I know I can't see this person or if, you know what, they need a bone scan, off you go to get a bone scan. I'm not going to do anything until you get one. And it's sometimes I think, like I said, there's not enough information for everybody. And so sometimes it will come in just for a consult. And I've had times where I've had to refer somebody to a hospital because I'm like, and I'm like, right now, a walk-in clinic is not the place to go. You really need to go to the hospital. The closest one to us is Concordia. So we have sent a few people down to Concordia and, they get checked out. They're cleared. They're good to go. And then we can move on from there. But it's always just about the person. That's how I feel when I go to any of my healthcare providers. And that's why I say it's always good to find out more about that person. If you won't jive with everybody, right? And so you want to find someone that you can trust, that will take care of you. And that's kind of how I am, even with my parents. My parents are always going to doctors right now, and so on my days off, that's what I do. I spend my day off traveling around and taking them to their appointments. And even there, a lot of their doctors know that I'm a doctor, so they will change some of the wording so that way I understand it better. And so also with my parents, we do have they don't speak English as well. They can do it. They can do it. They can understand, but
it's hard though. If you don't learn a language when you're young, it's so hard to learn when you're older.
Right. And and it's I can speak Hindi and Punjabi, so sometimes I'll have patients who come in who don't speak any English. And they only speak Hindi, Punjabi. It's a little bit more challenging for me to do a history exam in that language because I'm not used to those words. So it's funny. It's a funny joke that I will call my mom to ask her what this word means in Punjabi, and she's like, oh, it means nerves. I'm like, okay.
Oh, that's cool though.
Yeah. And same, we have another doctor there who's also East Indian, so same thing with him too. And also with different cultures, even if you speak that language, they might have different dialects. I know with us, we have different dialects as well. And so I find pictures are so great with helping, and you're like, can you just point to what you're trying to say?
There was something I think coming up in BC. You can just write out a care plan and then it'll translate it for you.
Okay,
in that specific language. So
sometimes people come with translators. Like I feel like I'm my parents' translator. That's kind of how it goes.
That's cool though. Like I wonder what that's so weird. Like, do you think in English or?
Yeah.
Yeah.
Well, I pretty much grew up here, so I do. But I mean, there's some stuff that I like. X-rays, like we had to go through my mom's MRI, her recent MRI and her recent X-ray, and so she didn't really understand. But I feel like they're more at ease when I'm there because she'll explain it to us on the car ride home, like that kind of
exactly
thing.
What's going on. Yeah, that must be tough, honestly.
No, not really. Like, they were traveling for 2 months. I didn't know what to do with myself because I had my day off. And I was saying this to other people. A lot of my patients know that on my days off, I do that because I'm always out with my parents. So they were like, so what have you been doing since they've been gone? I'm like, I don't know what to do with myself. I don't know if I should be napping. Should I? So I worked on more research for my blog. So I got a few blog posts down and...
There's always something to do.
There's always something to do. Always.
Do you have anything else you want to talk about?
Let me ask about you.
Yeah, ask about me.
Okay,
sure.
Well, what, I'm just like, I love medicine doctors too. So what made you pick that route?
Yeah, this is a tough question, right? Like I was saying before, chiro or medicine my whole life. I don't know what to do. But I always wanted to be a doctor because I always just wanted to be a surgeon when I was younger. Like that was my dream. I just always was so amazing to me that someone so qualified, they can literally, like just objectively speaking, they can cut somebody open, take something out, and then stitch them back up. They live a good life, right? So that's what always drew me towards that. But as I'm getting older and I know a lot of doctors and people in med school, I'm realizing, man, the 120 to 130 hour work week is not looking too hot for 7-year residency. So, I was kind of just thinking, what do I want to do? And I'm a huge biochemistry nerd. Me and my buddy Drake, we are such nerds that we literally listen to the nerdiest podcast called The Drive by like Peter Attia. So he's this, you haven't heard of it?
No,
I'm just kidding. But he himself went to Johns Hopkins. He was a general oncological surgeon, really prestigious guy. And he's like, I don't want to do this anymore. And became a full-time longevity doctor, basically. So it's seems to be like a newer field kind of emerging. And what he does in his podcast, he mixes like biochemistry, pharmacology, all this type of science and medicine in order to explore different parts of living as long and as healthy as possible. So things like Alzheimer's, cancer, heart disease, right? Like that's the main thing that older people die of. Doing research on centenarians, people that live to their 100, and they were finding out that those people still die of the same things, but it's just offset by like 20 or 30 years. So with his research, with all that, and the field as a whole, guided towards helping people live as long and healthy as possible, and it mixes biochemistry and stuff. So I just that's what I want to do. So I'm thinking maybe try to get into internal medicine, become an internist, and then just like open up my own practice maybe, because that's what he does. He just has like a select few of patients, and then he just tries different drugs on them pretty much and helps them live long. And the reason why this is so fascinating to me is because it focuses not only on one thing. It focuses on, kind of like chiropractic. It's like the whole body. And so you're not only worrying about Alzheimer's, you're worrying about cancer, you're worrying about heart disease. And everybody's completely different. It has different genetic makeup. So it's up to you to figure out what's the best for that specific patient. So right now, that's where I'm at. And the reason why I want to do this too is because there are like a lot of drugs on the market right now. Like there's metformin, there's rapamycin, there's resveratrol. There's all these different drug trials. There's human drug trials going on right now. Various different people of different ages and different populations. And they're just going to see within the next couple of years to see if like supplementing these drugs will improve the health span and their longevity. So that's currently in the process, and I'm just fascinated with that because in the future, there's not a lot of people in Canada doing that. I don't know if many people are. There's just like people in the States right now, but just the future of thinking about, wow, this podcast, one day if I'm a longevity doctor or whatever, I can like spread the message through the podcast. If it's like, oh yeah, make sure you take 2 grams of this supplement every day, or something such as that. And yeah, so just lately I've been obsessed with longevity because it mixes my passion for the biochem of the body and living longer, so I could help my family and friends live as long as possible. So
yeah, I really love wellness care. Like for us, like that's what I would call wellness care.
Okay.
And I absolutely love it. I love when I hear this. I don't know if you've heard about this. There's certain health centers that are opening up. So they've got all these disciplines in there. And I love that there's so many of them working together to like actually have really great results.
Collaboration.
Yeah.
That's what it's all about.
And and sometimes people say, well, I don't know if I should go to a physio or if I should go to chiro or if I should do massage. And I'm like, you know what? It's better to have an actual team instead of just one person, because sometimes one person isn't enough.
It's true.
And like with massage, I always recommend massage, especially if someone's so tight and I know graston's not going to help right away, and I'm like, you need to go get a massage first.
You need to get it worked.
Yeah, you really need to go get a massage. And for physiotherapy, I know there's so many ways people can really benefit from physiotherapy. So I love where I see the future going, and I've seen it actually in BC as well as in Ontario, and I think there's one clinic that might be opening up in Alberta. There might already be one there, but I'm excited for it to come to Winnipeg.
Yeah,
I think we're kind of a little behind.
A little bit,
I find just a little bit, not too far, but like just having a wellness center with everything in it would be so great.
Oh yeah, that would be so cool. And there's things that the massage therapist that would see that maybe the chiro wouldn't, or the chiro would see that the doctor wouldn't. And it's just all about teamwork and really focusing on the patient and what they need.
Right.
So,
and even like with naturopaths, like there's so many things that they can do that we wouldn't know too much about.
It's true.
And there's so many things.
It's cool. So you just combine all of it in order to give the best quality care you can. That's what it's about at the end of the day.
Yeah, exactly. So. I totally agree.
All right. Any other questions for me or no?
No, I think that was it.
That's it, eh?
Well, actually, no. I have another good one. I don't know if your listeners would want to know this. Why did you decide to make this podcast?
With you?
Well, no, just in general.
Oh, with just in general?
Yeah. Because
I just always wanted to have some type of content online, I guess, and I just had the year off, and I'm always keep myself super busy, so I was just dying not in school, and I was just working, serving lots. I'm like, you know what, I'm just gonna start a podcast. I don't care. And I just kind of went in with no real solid plan. I was just gonna figure it out as I go. It's called Black Coffee with Ice because I fast. Most days I fast. Okay. The reason why I do that is just because I know it's not for everybody though. It's just a disclaimer. Some people have struggled with like eating disorders and things along those lines. It's not for everybody, but just the reason why I practice it is because when you're in your fasting time, when you're only having water, tea, black coffee with ice, or other things, your body's not producing any insulin, so you don't get inflamed. Each time you have sugar, your body produces insulin, inflames the body. So if you're eating like 6 times a day, you're having those 6 mini insulin spikes. That's why people are like tired after breakfast. But the reason why I'm doing this and I feel a lot better is just because it decreases the amount of inflammation, and if you decrease the amount of inflammation, it seems to have a positive effect on longevity. So yeah, it
does. Yeah, it's true. Like when I'll have it's funny you say that, because I'll have people come in and they are super inflamed, and if everything is inflamed, they're putting more heat on that. I'm like, well, you're just making it more inflamed. You need to switch it to ice, like with swelling, right? So I'm like, you really need to put ice on that. They're like, well, I like heat better. I'm like, doesn't matter what you like better. It's what your body wants you to do right now. And so yeah, I'm glad that you said that. The inflammation is a huge thing, and I think it's happened a lot more in the past few years, and it probably has something to do with our food that we're eating, I'm sure.
100%. Like people say that preservatives aren't bad, and GMO is fine and all this stuff, but why is there such a higher rate of cancer these days compared to,
or even allergies?
Yeah, allergies.
Yeah. I know there's a lot of stuff. Like I remember when I was growing up, maybe 1 or 2 students in like our school had peanut allergies.
And now
there's so many
so
many different allergies. So Yeah, and my friends that are nutritionists always talk about inflammation, like that's like their big thing. And gut health is something that they
that would be so
talk
cool.
about all the time.
Maybe in the future, you and because I have multiple mics, right? So
Oh, yeah,
maybe
yeah.
we could have, a little
Yeah.
nutritionist, chiropractor, talking some health topics or something.
Yeah.
That'd be cool.
Yeah, well, we'd be here for like 5 hours.
That's cool, though. I just got to get cameras that last that long.
Yeah.
It'll be fine.
Yeah, no, gut health is a huge thing. And yeah, like I say, it's everything that you're putting in your body. It all comes out somehow. So
yeah. You are what you eat.
yeah, that's true.
Before we finish here, just explain like what chiropractors do.
What do chiropractors do? Okay, so we deal with mostly musculoskeletal stuff. So musculo is muscle, skeletal are your bones, and so together, you have your low back pain, anything that causes mechanical pain. And so we work on all of that, especially with what you'll notice is if a joint is not moving as well as it should, you'll have like reduced range of motion, and you'll know that when you have that weird neck pain or that weird back pain, you're like, oh, I can't turn this way. That's usually a combination of your muscles and your bones. And so we work on that. We also focus on the nerves as well. So in your spinal column, you've got a whole spinal cord that's in there, and each part of the vertebrae that goes down your spine, there's nerves that come out. Some of those nerves go to different organs, and so it's super fascinating. I sound so nerdy just talking about it.
I like being nerdy. Yeah, tell me.
I love neurology, so it's so cool. Like if you think about, like for example, T4, so that's your thoracic vertebrae, which is about your mid-back spine. So T4, the fourth nerve that comes out of that thoracic spine, goes to the gallbladder. And that's usually around your shoulder where that nerve is coming out. And so there have been times where you can kind of correlate a lot of things like, oh, are you having any issues with your gallbladder? And they're like, well, what kind of issues could that be? I'm like, okay, well, there could be issues with your digestion, your stools. There's a lot of stuff that could be going on. And so sometimes patients already know they have gallbladder issues before you even ask them. Yeah, so each nerve goes to a certain part of your organ. So the low back, the lumbar vertebrae, the sacrum, those all go closer to your reproductive organs as well as your excretory system. And so, I don't always say this is going to happen, but sometimes if you have constipation issues, even just adjusting in there, I've had some patients tell me that, you know what, I actually went and I can't believe it. And I'm like, okay, well, I can't say cured it. Like, nothing cures anything, right? So just adjusting in there, it helps. And they're like, well, why? And I'm like, well, that nerve goes to that area and it's innervating it because it wasn't working for a while. Or you know what? Sometimes it could even be just a combination of things going in your digestive system. Maybe your large intestine isn't moving as properly as it should be. There's so many things.
That's really cool.
It's super cool. The more you learn about it, the more you're like, oh my God, like there's so much. Everything is connected.
Damn.
And everything has a purpose.
Yeah, that's one thing. It's like evolution doesn't have time for redundancy, I guess.
Right.
Yeah.
So so when you think about it, how is the messages going from your organs to your brain? They travel through the nerves. The nerves are the ones that are doing it. The nerve is connected to the spinal cord. Spinal cord goes all the way up to the brain. So it's a whole connection. It's not just one thing or the other.
Can you explain some other parts and what they do of
other
the
parts?
back? Yeah, I'm going to test you right now.
There's so many. There's so many. Like there's also, like you've also got cranial nerves, which are all over here. So the cranial nerve, I think it's the vagus nerve, that one that goes to your diaphragm. And so I've talked about this before on my blog. So if you're super stressed, you're not using your diaphragm. And usually that's kind of when that fight or flight response, right? And so you just kind of need to stimulate it a little bit because that's that nerve that goes all the way there, trying to tell your diaphragm, okay, you know what? We got to breathe a little bit better. It's so cool. Yeah. There's so much to it. And if you're super stressed out, you're always going to be in that fight or flight response.
Oh, that's the sympathetic, right?
Right. Parasympathetic is resting. And so, you don't want to be in that state all the time. You want to decrease it as much as you can. So pain is a big thing. Pain is always the last thing to show up, and it's the quickest one to leave whenever you're in any sort of condition as it is. So when you're in pain, you try to guard yourself. You're trying to be super protective which is not making it any better because now your muscles are going in like this all the time, or your low back is you're just bent down all the time.
Damn.
I know there's so much
It's just
to
all
it.
connected.
It's all connected. I always say that. I'm like, it's always connected. Like you can't, there's no other way. That's just how our bodies are made.
Mm-hmm.
That's anybody in like animals, dogs, same thing.
Oh, I actually saw a horse get adjusted before.
Isn't it so cool?
Yeah, that's so weird. I had no idea.
It's
that
so
you
cool.
could.
There's dog chiropractors too. There's a few, I think, in the city, 1 or 2 of them, but you have to be more specialized to do animal chiropractic.
Like a specialization kind of thing. And how
Yeah.
about babies? Do you ever crack babies? Because I heard it's good if you have colic.
You mean adjust babies?
Yeah. What'd I say?
Crack.
Oh, sorry.
No,
Damn
it's okay.
it.
I actually don't adjust a lot of babies. I do. We have someone else in our office who loves adjusting babies, and so she usually sees a lot of those. I have a few kids. The youngest kids, they're always so fun because we always call it popcorn when we adjust them, right? So when I adjust them, and I sometimes will use the activator, and they always call it the stapler. So I'll have like my youngest little patient, I think was 4 years old. And just so cute, and they've got such little spines, and babies and kids are the easiest ones to adjust.
Just like less pressure, I guess. It just kind of.
Well, their muscles are so nice. They're nice and smooth.
Yeah.
They haven't had all the work that we've had to do
They've
growing
just
up.
been slammed with life.
Yeah, they haven't, right? So, and they bounce back a lot faster than we would. And so that's why when the older you get, if you leave things off for too long, the harder it is to recover.
Yeah.
And so I always, people come in with, like I said, 30 years of pain. And if one visit isn't going to help, well, yeah, one visit isn't going to help. It's been 30 years. Like, nothing is going to work instantly. You can't go to the gym and expect to lose weight with just one time you go to work out. If that was the case, nobody would be doing anything. There wouldn't.
Lifestyle.
Yeah, and it is a lifestyle. So it's like you kind of have to, I feel like that's with any profession. You kind of have to just remind someone, you can't just do one thing once and expect it to be okay. So when I have had patients say, oh, you know what, I've gone to a chiropractor before, it didn't help me. And I'm like, okay, how often did you go? Usually it's 1 or twice. I'm like, okay, well, how long did you have that pain that you were there for? Oh, I'd been there for years and years. And I'm like, well, 1 or 2 visits isn't going to help. And I'm like, I'm sorry if you thought that. Like, I apologize. But, even here, I don't want you to be expecting that from me either, because 1 or 2 is not going to make it better. Yeah. And even for, like, myself, I sometimes do hurt myself quite a bit, too. And so I sometimes have to get adjusted twice a week.
Damn. Yeah, because you're always, like, bending over.
The more hard you are on your body, the more your body is going to need some tune-ups. And so patients are always surprised when they're like, oh, who's in Dr. Sani's room? And they're like, oh, Dr. Sani's getting adjusted. They're like, she gets adjusted?
She practices what she preaches?
I was like, yeah, I have to. They're like, why? I'm like, well, I felt a rib go. Like, I could just feel it. It was just such sharp pain. They're like, that happens to you? I'm like, yes.
Yes, I'm a person too. Yeah.
Like, it happens to everybody. So I wish I had taken pictures because a few weeks ago I'd gotten pretty injured and my hip was really out. And when I mean out, it wasn't very leveled. And so the doc at the time that was adjusting me said to me, it was so funny, and I'll always remember this. He's like, why aren't you lying down properly? I'm like, I am. And he's like, no, you're not. Like, put your hip down. And I'm like, it isn't. I'm like, it is down. It's normal to me. That's how it felt. And it was such a good eye opener for me to see that, patients do come in and they think, oh, everything's fine.
But it's not.
Until someone looks at you and tells you, like, no, your shoulder's really low. Do you realize that you're walking with your 1 foot going out and the other one's the other way? Like, and so when he said that to me, I was like, we should have taken pictures. Like,
it was that, like,
it was very off. And he was just like, your hip is not touching the table. The other side is. And he's like, here, I'll show you what it looks like with your hip touching the table. So when he pushed on it to put it down, it felt so wrong. It didn't feel comfortable to me. I was like, no, that feels weird. I'm going to put it back to how it was. And he's like, fine, you're not touching the table.
Holy.
And like, that wasn't one fix.
Yeah. How long did that take?
I'm still getting treated for it. So it's been probably about 2 months now at this point. And even for someone who does get adjusted a lot, there's just some things that do take time. Mm-hmm. Just like with anything.
I guess it's almost like a posture issue too. Mm-hmm. I mean.
And I don't think it helps when I am also bent down, and I try to work on it too. I try to do my stretches. We have foam rollers in our offices too that we use. It hurts, but I do it. And the funny thing was that how this injury happened was through yoga.
Whoa.
And I love yoga. And so I was at a yoga class and we were doing downward dog. I don't know if you're familiar with those poses.
That's where I hurt my knee at hot yoga, Moto yoga. I love yoga, but it just fucked up my knee. I was doing Warrior 2 and I slipped on my back foot and then like all my weight kind of like, and then it's just been, it's like sharp pain out of nowhere sometimes, but keep going on. Sorry.
Yeah. I think it also depends on what kind of yoga teacher you have too. So the yoga teacher I have, she's so great. She went around the room fixing people's positions, and they don't do it to make you feel bad, which I've heard patients say, oh, I just feel bad when they do it. I'm like, no, they're doing it so you're not hurting yourself. So when we were doing downward dog, and I swear to God, my hip made the weirdest sound, which is normal. Yeah, which is normal for me, which I know, because I am always adjusting, right? So the two girls next to me both turned and looked at me. They're like, what was that? I'm like, oh, it was my hip. And they're like, are you okay? I'm like, yeah, I'm fine. And the next day I went to go see my doc, right? So I didn't want to wait too long. And I was like, you know what? I'll just ice it when I get home. I'll stretch it out. And it wasn't super painful. But I mean, I'm just saying, like, simple things, even if you're not thinking, can put you out of alignment. It's very common. I mean, even if you see a pothole, we've got a lot of potholes here, right? And if you're walking and you're not looking, you put one step in and you're trying to get yourself back to normal again, right? And you'll get a sharp pain. It happens. It's everyday life, right?
I know. I just want to be perfect, though. I don't want any pain, but whatever.
But see, the more you take care of it, the easier it is to bounce back. That's the only thing. So if I wasn't getting adjusted myself regularly every week, I don't think my hip pain would be as mild as it is right now. I think it'd be super sharp.
Yeah, I know. And see, that's what I try to tell people. I'm like, if people have back pain or some type of like, I guess, osteo or like bone issue, for example, you don't always have to go right to the doctor because, like not like the medical doctor, because I feel like a lot of people who maybe might have a negative perception on chiropractic might go straight there. But I've heard of so many terrible stories where like people get their like disc like dissected and, that leads worse pain down the road when you could have just like gotten adjusted. Like I have a friend that, had a really bad lower back pain and then, doctors were saying, maybe surgery down the road, whatever, but he went to chiropractor and now he's feeling good. Now,
that's good, yeah.
So it's just like, you just got to explore your options before.
And I've noticed it's changed quite a bit because I've, some of the patients that are coming in now, I've noticed recently in like the last 6 months or so, they're like, I just want to get to the bottom of this and just do something because I've taken so much of this and so much of that and it keeps coming back and I just don't want to take time off work anymore. I'm so tired of taking time off work because of my back. I just want to do anything. And so, they start exploring massage, physio, acupuncture, like everything, right? So I'm like, this is a great first step that you have decided to take. So I'm always like, well, I'm so glad you're here. Like, let's just figure out what's going on. And, they're like, wow, it did hurt the first week or so and then, or even just the first couple of days, but they're like, I've noticed a lot more improvement. And if you give them enough tools, which is what I like giving is tools so that you know what to do if something happens. So I always say, if it starts hurting right away, it's acute, definitely put ice on something.
Okay.
Ice is a lot better. It may not be comfortable, but it's a lot better, in my opinion, compared to heat at the beginning.
At the beginning, right? But then eventually, should you go to heat at the end? Okay.
I would switch to heat once you start, like, maybe in like 4 or 5 days later.
Okay. Like once the pain's gone, like once the constant pain's gone, I guess.
Because at the acute time is usually when things will flame up. And if things are flaming, you're going to get more swelling.
More inflammation.
Right.
More heat.
Yeah.
Tense.
Yeah.
Stress.
Exactly. Stress, not sleeping.
Yeah. Damn. Oh.
Yeah, it's just a whole cycle.
Endless cycle. And you're here to break the cycle.
Well, let's hope we all can.
Yeah. All right. Well, I guess that's everything.
Mm-hmm.
All right.
Okay.
Thank you for coming on. I appreciate
thanks for
it.
having me.
Yeah, first of many, I hope.
Yeah, I'm so glad you're doing this.
Yeah.
This is so great.
Yeah, thank you for taking the time, being the first doctor ever
Aw.
on the show. I'm so happy.
Oh, good.
yeah,
I'm happy to
finally.
be here. It's my first podcast ever.
Really?
Yeah.
Wow.
I did the radio. The radio thing was the first time I talked on like live, which was a little nerve-wracking.
Yeah.
And then after that, I did my first live video. I've never done that on Instagram.
Oh yeah, I
I
did
did
that
it-
the other day. It's kind of I don't even know what to do in that point. It's
It was a little nerve-wracking, and it was funny because everyone's like, "Well, I didn't feel like you were nervous." It was like, maybe it's just in our head, right?
Mhm.
So we all think like that. But I did it with my friend Danielle that I was talking about earlier. We did it for the pregnancy series that we had started back earlier in the year. So we did a live, and I told her, you know what? Like, I just want to practice, like, public speaking and all of that. So I'm glad we're doing a podcast.
It's just, and that's what I realized. You know, if you look at my first podcast, it's almost cringy. It's so cringy how many times I say and when I get excited, I'm like.
Right.
But it's just a skill, just like anything. You have to
Keep doing it.
and then one day when we're on episode 100, and we'll just be like experts. But no, you just got to keep on practicing. But yeah.
No, you're doing great.
Oh, thank you. I appreciate it, honestly. Okay, well, I guess that's a wrap then.
All right. Well,
Okay.
thank you.
Thank you. Yeah. Okay, bye.
Bye.